Good afternoon, Mossad Talk TV. So today we're here at the Powerhouse with the neighborhood health champions. So yes, how you doing, Sister Wendy?
I'm good. I'm Wendy Sims, as you all know me, and I'm the new coordinator for the health champion from Mossad. And today we have some issues in our community where I'd like to highlight it a bit more so my community can help to solve some of these issues in our community. So today I have with me no other than...
Hi, I'm John Edgerton, so I'm the Manchester Local Care Organisation Neighbourhood Lead for Mossad Human Russia.
Okay. And John, let me ask you, what exactly does that mean? What do you do?
So I've got responsibilities for services including district nursing, health development coordinators, care navigators, and basically the role is to support working with VCSE organisations, primary care, all of our services, and of course most importantly our communities, to try and gel everyone together to best improve health and well-being in this neighbourhood.
Thank you very much. And right next to John we have...
I'm Annie, my surname is Tunin, and I'm the Health Inequalities Lead. I'm a nurse with the Better Health Manchester PCN, and like my title says, my job is to tackle the health inequalities that we keep finding with all the patients in our GP practices in this area.
And of course we have...
my name is Sadi, and I'm Master of Public Health student, and I'm working here as a neighborhood health champion in this lovely community.
I'm Chantal Holland. I'm part of the Neighbourhood Health Champions, and I'm also Director for Keeping the Real Children.
Great, thank you very much for being here today. One of the main reasons that I called you all together, basically, is that we have an outbreak in our community, and it's measles, and I would like to know a bit more information talking about the measles and any other issues that we have that can highlight. So can I start with you again, Annie, please? What is measles? What is it really?
So measles it's a viral infection, okay? That's important because that means we can't treat it with antibiotics. We have to fight it ourselves. It's not really seen as a really major disease up until quite recently because there were so many people vaccinated that we never saw the disease. But it is actually potentially very serious. Before vaccination, it killed 1 million children a year, every year across the world. And even now in Africa and poorer countries where children are poorer, it still kills 10% of all children who get it. So it's not a mild disease, it's horrible, really. In this country, we don't have quite such a problem with death. So most children who get it, and most adults who get it here, if you're not vaccinated, are not going to die. But some will, and there are many other complications that can really, really ruin your day and can be life-changing. So it is dangerous.
So you're saying, is vaccination one of the key points right now for these measles?
Yes. So before the COVID pandemic, because I think there wasn't measles and there was starting to be some theories and worries that information was being put out saying that vaccines were dangerous. Because of that, people were starting to not vaccinate as much as they used to before. And what slowly happened was that the risk of measles went up and up and up. And then, of course, with COVID, there was even more worry about all kinds of worries about the safety of vaccines. And that kind of made people feel really nervous about all vaccines, not just COVID. And since then, less and less children have got vaccinated. So in this area, we're down to less than 80%, I think, of children are vaccinated fully against measles, where because it's such a catching disease, 95% of children have to be vaccinated to stop the disease spreading, and we are not close.
I know you mentioned vaccine, and in our community, we don't really do vaccines very well. One of the things I'm going to say to you, why should we really trust vaccine at this moment? Because we see what happened in terms of COVID, and in our community, we're saying I think that 99.9% people said no to vaccine in our community. Yes. Yeah. So is this another scare thing against us for the children to get vaccine, or is this a genuine thing that we can say, yeah, vaccine does help in our community for this? Because looking at what happened with COVID, really and truly, it's not, vaccine is like not the word for us right now, and probably that's why you see so much people not taking vaccine. And now here it is again, you're talking about measles, and that need vaccine. So what is it really that we should be saying, looking at this as a health issue then?
Yeah, good question. And I think I would start by saying I'm a nurse, and I've been a nurse for more decades than I want to talk about right now.
Okay.
And I think one of the things that to me is that one of the basic foundation points of being a nurse is that I'm here to help people to make the decisions that are right for their health. And I'm passionate about that. It is not my job to frighten, bully, pressure people into making the decisions that I think are right for them. So I think that's where it starts. So when somebody says to me, well, is it right? And I've heard this, I'm like, yeah, go for it. Ask me, because that's our job as consumers of health. It's our job to say, well, is that right? Okay. So my job is not to convince, my job is to explain. I will put it that way. So I understand the worries about the COVID vaccine, and I won't try and answer all of them here. I think one of the big differences between something like the COVID vaccine, which is quite new, and it wasn't designed at that stage to stop infection. It was designed to make sure that the symptoms were lower, so that people were less likely to die. It's very different to the measles vaccine. So the current MMR vaccine started in the late 80s when I was already a nurse. And that was predated by another measles vaccine, which people my age would have had maybe as younger people. That vaccine has, there are all the sort of ideas that go around about the risks, and there's sort of various things come around at different times. I think my answer would be this. At the point where I was a mother of a little girl who was due to have, it was time for her to have her measles vaccine, was about the time that all those scare stories came out about, what risks there might be. And although I was already a nurse, and although I was pretty sure that things were safe, there was no way I was going to stick a needle in my baby until I knew that vaccine was safe. So I had this little puppet, like half asleep in her car seat, rocking her with one foot while I went through book after computer, after report paper, after research paper, until I was sure that it was right. So I think, because I know that I would trust that vaccine with the children that I would give my life for in a heartbeat, I feel confident to give that information out.
Chantal, you're shaking your head as you say, yes, you agree to this vaccine. Is there something you want to say about it?
Yeah, I do agree with it. I mean, I've had measles as
you?
a child.
Wow.
I remember it was the worst thing in my life, and then when I had my daughter, none of those rumours, if you say, scared me into it. What scared me was her having it and feeling like I did. So I was proud to give it her. Yeah. And she's 22 now, so I was proud.
Wow.
Everybody's like, wow, you didn't expect that. You didn't expect that. Everybody's like, really?
It's like having it yourself, because not many people know about what it's like.
Oh, it was awful.
Yeah.
I was only a child and still remember it now.
What was these symptoms? What
it was just a rash. I just felt groggy all the time. I just couldn't eat. I lost a load of weight from it. Yeah. It was awful. It was really awful. My poor mum as well. She didn't know what to do.
Yeah. So for you at this moment and hearing about the measles are like a shock me back again.
Yeah, definitely. Yeah. It really is, definitely. And like I say, I didn't have no trouble with taking my daughter to go get her injection at all. I didn't. As soon as that letter came, I was
Well, I guess that for you, I like the way she said, well, sure. So did you hear from another mother who had measles, who had a child at that age, and your child is about?
She's 22.
22 at that time. Is that the same vaccination that she would have at that time? Would be the same one?
And in fact, it's so those are the group of young adults now who don't have. Lots of them didn't get the vaccine at that stage, and I worry myself silly about this group of, the boys matter just as much, but the women are particularly vulnerable because it's the stage where you're starting to think about having kids. And now the groups that are most likely to be very sick with measles, much sicker than you were, because obviously, is pregnant women. Can't vaccinate someone when they're pregnant. So once you're pregnant, that's it. You've got to just hope that you're okay until the baby's born. Babies under a year old, so little babies. and the very elderly, and children who have problems with immunity. So, for example, if you have a child who's had chemotherapy, and we do have them, we can't vaccinate them while they're on chemo because their immune systems don't work. Okay. And they are the ones that are at risk of the awful things that happen, like meningitis, like lung inflammation, ears. You get septicemia, the blood poisoning, and we do get children who lose legs, who lose their sight. These things happen. So, and it happens to those who are vulnerable. So yes, I think this is the group I worry about in particular. And then, of course, when they go on to have babies, they can't pass that immunity on even to the tiny babies to protect them because they don't have it themselves. So for that reason, I would say that if you're young and you haven't had it and you want to have it, talk to us.
So, John, let me ask you now, so where is the lowest in terms of vaccination that's going on right now?
Well, the data is telling us that this neighbourhood is one of the lowest areas.
Is that Mossad? Which?
So we call the neighbourhood Mossad Human Russian.
Mossad Human Russian, yeah.
And the data is telling us that we are very low. And that's consistent, obviously, with, as we've discussed, COVID vaccinations, etc. So what we're trying to do, and Chantal and it's very eloquently described, the issues and the importance of this. It is about people's choice. But what is really important is we're putting all of our effort into preventative work. So, for example, currently we're providing an immunisation offer in addition to normal immunisation offers to our primary schools and our secondary schools. And we can say that certainly in our primary schools, 25% of those are very low. Yeah. Some of the lowest in the city, if not the lowest. So we talk about what we need to go back to 2017 when we eradicated measles. It didn't exist in this country because 95% of the population were vaccinated. We had that immunity. Some of the schools currently are less than 50%, a lot lower than 50% in terms of the children who have been immunised. So we've got a schools programme, and we'll be working very closely with some of those schools, with their leadership teams, and how we can ensure we've got additional vaccinators in there. But again, it's about trust and confidence, so we've got to ensure that people are aware of the correct information, make the right choices. Obviously, the neighbourhood health champions have been doing some brilliant stuff around information engagement, making people aware of this. We've got primary care, people like Annie working so hard, making phone calls, texting people, even nurses having appointments to have a discussion around the issues that people are worrying about, so face-to-face conversations just to clear myths and misunderstanding, because that's really important as well, misinformation about these vaccines, so that's really key. But we are a priority area, and we have an awful lot to do. So this is why today is very important. So we're having these conversations, but we're working through how to approach it.
I know you're going to say, John, I'm going to say, like I'm going to say this down. I don't want this vaccine. I'm not going to take this vaccine, okay? Is there another alternative medication or anything that can be taken if you don't want the vaccine? Is there anything else apart from the vaccine itself?
Well, I think I'll hand myself over to
I'm just asking because I know.
It's a sensible thing to ask if you're worried about the vaccine. Unfortunately, the answer is not much. It's there is no alternative vaccine. In the olden days, as in like when I was a little bit younger, there was a just measles and a just MMR and a just mumps, but they weren't actually nearly as good as the MMR. And you could I think try and get them privately, but there's no gain. You could try that if you wanted to, but you could not do it on the NHS because they don't have the supplies. The only other thing, there is no way to otherwise develop any immunity except by actually getting the disease, which will make you immune, but it's at a cost. So I guess you can isolate. We're back to COVID ideas here, but you can isolate. But of course, the trouble is that Most people who are very, very infectious with measles don't know they've got it yet. They haven't got the rash, they might feel a bit off, but the fever hasn't come, so you can't spot it before it's infectious, and you won't know that you've been in contact with somebody. And then the problem is, in a room like this, if we had, say, 100 people stood in this room and one person that weren't vaccinated and one person had measles, 98 people in the room would get measles.
Wow.
It's that catching. It really does make COVID look like a walk in the park. It is. And at the moment, for example, it's our healthcare workers who are already vaccinated who are getting measles because they're catching it from children who are right here in their face who are sick.
So let me repeat this one. What is the symptoms of measles?
So the first symptom of measles is you start feeling like you've got a horrible cold. Your eyes are streaming, you cough, you feel dreadful, as you know. You get a high, so your fever climbs all the way up to like 38, 38.5, 39, and by the time it gets like 39, pushing 40, you'll start to see a rash comes out on your face, behind your ears. It's like a red, blotchy rash. On white skin it looks really red. If your skin's dark it can look more like brownie, sometimes more just like feels rough to the touch, it feels funny to the touch. And some people will just have a little bit of rash, some people will have a lot of rash. That usually kind of fades after about another six or 7 days, so you're sick for a good 7 to 10 days, as in you are in bed. You are not feeling okay. You are definitely not lying on the sofa watching the TV. You are ill. And then most people, like I said, will recover. And so that by kind of 2 weeks, you're probably about more or less ready to go back to school and possibly to go back to work. So it's pretty fierce. So, and once you like that, somebody has to look after you. You're not in any state to look after yourself. So of course, mothers have to
vaccinate as
well. Mothers have to then take off work, or fathers have to take off work. Children are sick and need looking after.
Wow, it's kind of scary.
It's not good.
100 people in there, one person, 99 people is more likely. That's worse than COVID too.
It's 20 times, I think 18 times more infectious than COVID.
Wow.
So when, for example, it is actually a colonial issue. I'm just saying, it's Africa sort of knew measles a little bit because measles started somewhere probably around about the Middle East and then spread down with various with Arab trading down. This is sort of the early hundreds, not even like 1000 BC. So there was some resistance to measles in South Africa, in Africa already, but still, like I said, children die in their millions. When the Western European explorers headed over to America, they pretty well wiped out half the population of South America and North America with smallpox and measles. Cuba lost half of its indigenous population. This is before there was even slave trade. Cuba lost half its population to smallpox, and then half of those that survived died of measles within a short space of time. That's how dangerous it was. Yeah, it's no joke.
So, I mean, that sounds. I mean, you talk about a little bit about Africa.
Yes.
Were you in Africa at all yourself?
Totally.
I'm definitely South Africa.
What I've seen in South Africa is, I think I was in South Africa in the middle of the HIV epidemic as it was really taking off, and I worked with children who were HIV positive, and very large numbers of them. And there again, measles is a killer, because they're children with immune systems that are not working really well. So in southern Africa, so from say Malawi down, so Malawi, Zambia, Zimbabwe, Namibia, South Africa, there was a really, really concentrated World Health Organization initiative to take the MMR to children. And it took the death rate, the mortality rate from measles, which was at that point happening over and over again. They took it from, it was 500,000 kids down to none. Vaccinations stopped children dying of measles. Remember, that wouldn't happen here because we don't have such poor malnourished kids, so you don't have such a big problem. But that's the power of vaccination.
Yeah. Whilst we're mindful, this is a very balanced conversation. We've got to really consider, however, that as Annie's articulated, that it's very spreadable, very contagious. So one end of the spectrum is over a couple of weeks period, child's off, so etc. The other issue around that is obviously the spread, so you could have schools closing, etc. My nursing staff being in contact with people being contaminated, and that obviously puts stress and strain on the NHS. But I think most importantly as well, we are having children already hospitalised through measles. And in extreme cases it can cause deafness, blindness and some brain damage. So it is a very serious disease, and clearly our ambition is as everyone's is, as we've all discussed, is to protect our children in the best way possible, to give people the right choices and the right access to these free vaccines.
So I think I would like to just add, if that's okay, is that so if you asked about what to do if you choose not to vaccinate, and like I said, I believe that people have choice and they should be supported to make their choice. That's the way we're a democracy. That's what we should do. So if you choose not to vaccinate, you do have to be very, very. You can't prevent everything, but you would have to immediately isolate if there was a measles epidemic. If we knew that there was measles around you, we would be advising you to stay out of contact with people because of that catching. And that can be quite difficult. If you knew that you'd been exposed to somebody who'd had measles for sure, and you were with them, like I said, the chances of catching it are so high, we would then recommend that you would need to contact your GP and discuss how to do that. If you had immune problems or you're pregnant, you must urgently contact your GP, because we may be able in the short term to give you a shockingly expensive short-term preventative to prevent severe complications, but we can't afford that for everybody. It's a lot of money for just one, and it doesn't protect for very long. So those are the things you would need to do, and certainly anybody who wants to can come to me and I'll give you a little summary if you like. But the other thing to bear in mind is that if you're vaccinated against measles, you have the resistance, and it doesn't cost you anything in terms of, it doesn't cause side effects. If you get measles, you will definitely be immune after that, or the same as if you'd had the vaccine. But for everybody who gets measles, whether they're very sick or a little bit sick, what the measles virus does is that it also attacks your immune system for other things. So for example, if you had a wee kiddie who's had, I don't know, let's say scarlet fever, and they've developed some immunity to that, so that the second time that they're exposed to scarlet fever, they won't be so sick. Measles destroys the cells that tell your body what to do the next time you meet that something. So you'll be sicker of other diseases afterwards for about 2 to 3 years. So I know it sounds awful and like I'm really laying it on thick.
It's not like it sounds awful. The truth is the truth, and that's what we want to know. We want to highlight what's taking place in our community right now. You know what I mean? For me, it's like, wow. I did get my vaccination because my mom made sure she was everything. So we did make sure with my children as well. But as you said, it's not everybody. We're right about now. So let me ask you, John, when did we find out that there's an outbreak in terms of this measles going on in our communities?
It's reasonably recent. We started to get the information, the data around areas of the country. So at the moment our focus is on London, the Midlands and the North West. So clearly what's happened now is there are a number of government and local processes put in place to monitor that, and we're getting that information. So obviously our priority is to do things like this and to communicate as quickly as possible and to make the offer to everybody as quickly as possible. And anyone can get vaccinated. One of the other issues we've got is people don't know whether they've been vaccinated or not. But I think Annie will say that it doesn't matter if you've already been vaccinated, it's not harmful to be vaccinated again, but we can do adults as well as children. There is a certain age limit, probably at my age, where I've lived around, where I developed immunisation at that time, with my age, but I think
you have to be 55 plus.
Let's not get the age group going. So I'm going to come back to you, Chantal. Recently we've been doing a lot of door knocking about the measles and everything else, because that's what was out about a week ago. We was out in terms of health champions and in our community What was your feedback on that?
I think the response was actually very good. A lot of people in our community didn't know. They didn't know, especially with the young parents. So even though we was putting flyers through doors and that, we were still stopping people on the street and handing them out and explaining. The response was really good actually, I felt. It was, it was taken well. They took the information and passed it on to friends and family and stuff. So I thought it was really good, and it was a good thing to do, and actually be out in the community and provide this information for people that didn't know.
And I mean, for me, I was out there as well. I gave it to some of the young men. And it's like, I said, I take this to, his girlfriend and his servant, let the children know about it. So, it was like, it didn't just like, no, and throw it away. It was actually talking about it and say, yeah, there is something, because again, sometimes ignorance in our community, like you don't know, but when you do know, it's like, wow, this is where we're at right now. So let me just say it again. In terms of health champions, what is one of the things that you've been doing? What is really health champion? Just give me a little bit of the health champion.
For neighborhood health champion, we are a very nice and lovely group. We try to do everything that we can in order to do some prevention activities in this community, because as you know, unfortunately, some problems like bowel cancer in this community is more based on data, is more than other places or communities. So we try to focus on some activities, especially preventive initiatives which can help to decrease some health-related problems. We had a lot of training sessions like bowel cancer screening sessions, training session for our health champions, and also recently we had cancer talks which tried and focus on evaluating and empowering us as neighborhood health champion to know how to talk to other people, to encourage them to engage in this kind of screening, like breast cancer screening program in this country or other activities. And also we had a lot of events here, health fairs and events which focused on increasing knowledge and awareness of people from this community. For example, the last one was, not last one, but one of them was festive fair, which focused on oral hygiene for kids especially. Or also we had a lot of this kind of events, which the next one is next week, which is Health Day on the 21st of March. And also we have some ongoing activities like Carbon Club project, which is an ongoing one, and it starts from December 23. But it's ongoing, and it focused on having a healthy house, how to be more efficient in consuming energy especially, and also being having a healthy house. And also we have international dance for our lovely women. It's free. So every Friday we are holding dancing, international dancing for women that can participate in it. So our focus is on doing every activity which can help to increase health awareness and decrease health inequality, because it's our aim, it's our final aim and goals as a health champion.
So yes, and Chantal, I know I'm part of keeping it real, especially with the food and everything else. We highlight a lot of issues in terms of the community. Do you think that the food have anything to do with all this health inequality that's going on in our community?
Yeah, I do. Being from the Caribbean myself, it's really hard to be able to afford our food that we enjoy, and we know that gives us substance and nutriment. So with that, it has I feel it has a real knock-on effect, especially with the elders and the young children, because they're not getting the food nourishment that they're supposed to be getting, and you can see it declining. So for us, working as keeping it real, it's great being able to source foods or cook a hot meal and, you know, just to provide for some people, because we are a very proud community. No matter which walk of life, most of us are proud.
Definitely.
You know what I mean?
Definitely.
So being able to break those barriers and even having those conversations about food, if people are low on food, you know what I mean? To me, it's great. You know, you're giving back and you're helping people out that sometimes that thought that they didn't want help, or you know, they need people scared to come and ask for it. So sometimes taking that away and just, you know, not being invasive but opening conversations is a great way to, you know, get to people.
And on that note, I'm going to just say, don't forget, and it's this Thursday coming up right here at the Powerhouse from the hours of 12 to 3. We're going to do our Neighborhood Health Wellbeing Event Day. And we'll have health advice, blood pressure checks, measles vaccination information, reflexologies, massages, fitness and gentle exercise, lifestyle and energy advice, food and refreshments, food parcel giveaways, helping hand vouchers for attending. Everyone is welcome, and we'll be right here at the Powerhouse. And also to add to that, I know on the 31st of March as well, we also have a Children's Day, which is at Hume as well. It's a giveaway day, and that's complimentary of Blacks TV. And it's about the community coming together as well in terms of that, and you know, whatever we can do to help our children. So John, I would say Annie, Isabel, Chantal, is there anything else that we need to get there? Even the cameraman, is there anything that you want to say?
Just let them know that it's for free, so.
For
that, yeah.
Oh yeah. Yeah. That's the thing. We always been doing free events. You know what I mean? That's no problem. Definitely, it's a free event. I'm looking forward to the massage if I can get in there. To be honest with you, but it's needed. This is not just going to be the only event. We're going to be continuing. This is the type of things that we're going to be doing, highlighting the issues in our community. And now you talk about even cancer and things. We already went on a training, and I hated the word cancer, and that training made me have a turn around, change our entitlement.
Think positively about
and think positively, because there is help for cancer. All we have to do is know the awareness. When we're doing things like this, we want the community to come out, because information is what's needed. We're going to be doing a lot more, but all we need is to everybody to participate with us, come and see what's needed. At the moment, as it's being highlighted, the measles, you know, and you hear the information that went out, and you know me as well, Sister Wendy, keeping it real, right? I say it as how it is. You heard the challenges, you heard the information that came back, you know what I mean? It's up to each other now where you go from here. I can't, you know, as we would say in our village, you know, we can bring the donkey to the well, but we can't let them drink the water, okay? We can't force them to drink the water, so it's up to you what you do now. And not just the information is to share it to everybody so that they know what's going on in the community. There's a lot more issues. We have cancer, we have prostrate, we have diabetes, the list goes on. And right now, our community is at the worst at the moment for every single thing in terms of health that I can think of. There's so much strokes going on right now. There's so much people dying. You know what I mean? We see it's like a norm in our community. Sometimes we forget to even go to any funerals. But right about now, some lives can be saved. You're going to say, well, when it's your time, it's your time. Fair enough, I understand that one. But right now, health is wealth. Thank you very much. And on that note, I say thank you again for each and every one.
Thank you.
Thank you.
Yeah. Any last words?
No,
If you have any questions, ask them.
Okay.
And don't forget the GP, they're there also. Thank you.
Okay, so where could they find any information regarding the measles if they need any? Is there like a hotline or anything like that, emergency?
There's a lot online. It can be hard to look through. I would say probably if you ask your GP for advice, that's probably your first stop. And John might have some ideas of where else people can ask.
Yes, so we've got information, as Annie says, online. We're putting it out into places like the Powerhouse, but also, you know, libraries, etc. Adult education service, as swimming baths, libraries, everywhere that we can, we're putting this information out. But you know, please, the schools are important for your children. Your GPs are very important. You know, if you need to get those vaccines, contact your GPs.
And the GPs, is that the only agent where you can get the vaccination?
If you're not up to date, we don't have two measles, mumps, rubella vaccines on your record and you're worried, your GP will vaccinate you.
Okay, thank you guys, yeah?
Thank you very much.
Thank you.
Thank you, and thanks for inviting us.
Okay then guys, yeah, so more Side Talk TV, so yeah, the health champions, yeah, so you guys are the information, so please go and look it up and make sure you get in contact with the GP. Thank you guys, yeah?